This is Breakout 1, which is EMSC Communications, how to share our successes. And we have 5 presenters today that I'm happy to welcome. First, Dr. Marc Auerbach is Associate Professor of Pediatrics and Emergency Medicine at Yale. He serves as the Director of Pediatric Simulation at the Yale Center for Medical Simulation and is the founding co-chair of INSPIRE. Emily Lemiska is the Director of Communications for the EMSC Innovation and Improvement Center. Dr. Phyllis Hendry is Professor of Emergency Medicine and Pediatrics at the University of Florida College of Medicine, where she's currently the Assistant Chair for Emergency Medicine Research. Dr. Eileen Klein is Professor of Pediatrics at the University of Washington School of Medicine. She is the Pediatric Emergency Medicine Fellowship Director and the co-director of Emergency Department Research at Seattle Children's. And finally, Mike Ely. Mike is the director of the National EMS for Children Data Analysis Resource Center, or NEDARC. Thank you all for being here, and take it away.
Thank you so much, Renee. So as you said, I'm Marc Auerbach. We're fortunate to have an esteemed group of individuals representing the full spectrum of the EMSC family here. And I just wanted to clarify, Renee, does the audience now see my head, or what are they seeing, just to make sure that they can see our panelists?
So it depends on their how they have their screen set up. I can see everyone in the meeting. You can change your layout though in the view button, the top right corner. Okay.
So if they click on view and on the speaker view, then they would just see, now I just see you. So they probably want gallery view to see multiple people. Okay. Excellent. So I think you'll see a lot of different talking heads if you're on the gallery view. I think, as was mentioned, I'm Marc Auerbach. If those that are not speaking can please mute. I hear some background noise coming from some individuals. Thank you. So in our discussion today, we're hoping to hear from our various EMSC constituents, from the state partnership grantees, from NEDARC, from PCARN, from EIIC, related to our communications. And as a first question, I'd like each of our panelists to introduce themselves and describe their investment in 1 or 2 sentences, and describe how you're involved in communications. And I think for that, we can start off with Eileen Klein from PCARN. You're the one in my upper left, and then I'll announce some other people and we'll go around the horn. Thank you.
Great. Well, it's great to be here, everybody. I'm Eileen Klein, a pediatric emergency medicine physician. I am the PI for our West Node, and I'm vice chair of the steering committee of the Pediatric Emergency Care Applied Research Network, or PCARN. And just to make sure we're all on the same page, PCARN is composed of 7 nodes that encompass 18 pediatric emergency departments and 9 EMS programs across the country. And we conduct multi-institutional pediatric emergency medicine research across the continuum of emergency medicine care, from the scene to the hospital. And really, we can't be successful unless the research that we do has the results disseminated amongst our colleagues, to the EMS community, and to the broader medical and lay community. So I participate along with all of my PCARN colleagues in communications in all of these areas.
Thank you so much, Eileen. I think we'll go next to Dr. Phyllis Hendry, please.
Great, thank you. Can you hear me okay?
Yes, we can.
Wonderful. So I'm the Florida EMS for Children Medical Director. I've worked with our state partnership grants, the one in Florida off and on, I believe, since 1999. So we really work at the local level with the different EMS agencies and EDs in our state. I'm also a pediatric emergency physician, a researcher at University of Florida. The way I've been involved in communication is I started the Florida Ped Ready program around 2018, and then we started a website in collaboration with Florida College of Emergency Physicians in 2019, and we started a newsletter called The Pearl. Initially, that was going to be weekly. That was like writing a book chapter every week, so now it's more monthly, and with COVID, quarterly. We work with all of our different state partners, so that varies from state to state, but in our particular state, we work with our Florida Association of EMS Medical Directors and our other organizations that have different websites and newsletters. So again, state partnerships aimed at the local level. For example, every state gets funding for their program. So for a large state like Florida, we have over 300 emergency departments and 287 EMS agencies. So each state partnership is organized a little differently. And so communication is very important when you're trying to reach that many different individuals, and often those titles are changing. So thank you for the opportunity to be here today.
Thank you so much, Dr. Hendry. So we've heard from PCARN, our research network, Phyllis representing our state partnership programs in the Florida state. Mike, we'll go to you next to hear a little bit about NEDARC.
Great. Can you hear me, folks? Hope you can hear me.
Yes,
good afternoon. Good, thanks. Good afternoon, everybody. It's nice to have you all in this session. So my name is Mike. I'm with NEDARC, which is the National EMS for Children Data Analysis Resource Center based at the University of Utah in Salt Lake City. NEDARC is a sister resource center to the EIC for the state partnership program. And we, our essential goal is to help state EMSC programs to improve their capacity to collect, analyze, and utilize emergency care infrastructure data to identify both strengths and gaps and to drive system quality improvement efforts. We have been funded since 1995 and have done various things sort of throughout that process. We were we basically were funded because of through in 1993 there was an IOM report, Institute of Medicine report on the state of EMS for children, and they dedicated a chapter to the need for data and evaluation and research, saying without having a broad and reliable base of information, it's really hard for anybody, including policymakers, healthcare workers, family members, researchers, anybody to know systematically how effectively our systems are operating and what we can do to improve those systems of care. So our resource center again helps to state EMSC programs to improve their capacity to collect and utilize data for quality improvement efforts.
Thank you so much, Mike. Now we'll go to Emily Lemiska from EIC, our fifth in the family of programs here. Thank you, Emily.
Hi, everyone. It's great to be here with you today. So I'm the Director of Communications for EIC. I work within the knowledge management domain. I'm somewhat new to the EMSC space, having joined back in March. Previously, I worked with Mass General Hospital and a national nonprofit called the U.S. Pain Foundation. So EIC, as many of you I'm sure know, use these quality improvement strategies and multidisciplinary collaboration to improve pediatric care across the care continuum. And while I primarily serve EIC, because EIC helps support communications across EMSC, I've been happy to begin working with a lot of our other investments as well. So it's great to be here. Nice to see you all.
Thank you, Emily. So just to go over our objectives for this panel discussion, and I get the honor of being the hostess with the mostest, I guess, or the host with the most. But our hope is that after watching this panel, that you as the attendee will be able to succinctly state the value and purpose of at least three. We're not going to make you say all of the different family of programs by the end of the session, and be able to communicate that to the public, to describe three new effective communications channels, strategies, or practices used by some of these programs, and to commit to improving collaboration with other HRSA EMSC funded programs. We know that each of us are from different programs and have the opportunity to work together, but we're hoping that this panel will facilitate collaboration. So with that, I think we're going to go back around the horn and ask this question of, within your investment, what methods or channels do you feel have been most effective in sharing your stories and successes? And I think we'll start with Eileen again. Thank you.
Okay, thanks. I think that first we have to educate each other about our results. So really within PCARN, we have to share best practices and the results of the research that we do within our network. And that starts with our quarterly steering committee meetings where we talk about the projects. And then within each of our nodes, there are also regular meetings that we have between steering committee meetings that serve as opportunities for us to really disseminate best practices among each other. But as a network, PCARN is really committed to looking at the best ways to disseminate to the EMSC community as well as the larger medical and lay communities. And to do this, we've created a dissemination working group, and that's led by Drs. Julia Magana and Dr. Jason Woods. And we really leverage social media, podcasts, blogs, and videos to deliver results of PCARN work to frontline providers. So for a little plug, I recommend you go to @PCARN on Twitter, and you can learn a little bit more about how we're trying to disseminate the work that we do.
Thank you so much, Eileen. And I did put some definitions for those of you like me that are not having advanced training in communications like Emily. So channels are any method of communication. And we talked about social media from Eileen. We're going to hear from Phyllis next about something called a newsletter, but there's also websites, infographics, letters that Mike and Emily can add on, and then audiences. Within the EMSC space, we have this diverse set of audiences, including each other, as I mentioned, researchers, the public, families, legislators, advocates. So Phyllis, we'd love to hear a little bit about how your group has leveraged this channel of a newsletter to engage frontline providers within your state.
Great, thanks. So we tried to develop a newsletter and a website that would be a one-stop shop. You know, there's so many organizations doing great things for children. And when you're in a busy EMS, you know, maybe it's, you know, a small community ED or EMS agency, you know, they're also trying to keep up with a ton of other topics. So we wanted them to just come to one place where they could get national updates, state updates, anything about kids would be in one place. And initially we were doing, you know, monthly newsletter. With COVID, it's become more quarterly. So, but there's some things that were very timely, like a great educational course or webinar that you found out about last minute. So that's when we worked with our partners, and some of our partners have much larger infrastructure than others. So for example, Florida College of Emergency Physician works with the Emergency Medicine Learning Resource Center. They have a website, they have a communication specialist, they have a weekly newsletter. They also do the newsletter for Florida Association of EMS Medical Directors. So we partnered with them. So I literally send them emails every week. Anytime I get anything from all of you, something about pediatric disaster, there's a new course the hospital's offering for free on human trafficking, I shoot that to them and they get it out in the weekly newsletter. And then we do this monster newsletter, you know, on usually a monthly basis. And during that, besides educational events, news events, you know, we'll put new policies that are out. You know, what has NEDARC done that's new? You know, what is a new guideline that's out? But we also recognize champions and highlight some of the work being done at a local level. And everyone really loves, you know, getting their team or their colleagues' picture in the newsletter. So that's a little bit about what we've done.
Thank you so much, Phyllis. And if you have not seen the newsletter, I really think it does a wonderful job updating people, but also some great pragmatic education. And that concept of partner organizations is a theme that has come up, and I think it's important to leverage at both the national and the state level. Mike, bringing back that question to you, within your investment at NEDARC, what methods or channels do you feel have been most effective in sharing your news and successes and helping to achieve your objectives?
Well, we have a lot of, you know, as part of NEDARC, we've developed a lot of different resources to help communicate messages and help our, again, state partnership managers communicate messages. It's funny because one of the challenges, of course, is that in the information age, we're all bombarded by so much information, and it's kind of, we're all, you know, competing for people's time, limited time. And so we've tried to, you know, develop channels that effectively and concisely communicate a point or a message, you know, and hopefully in a visually pleasing fashion too, that helps to really draw people's attention. And so, I mean, we've got a number of channels, again, from, you know, traditional channels, you know, website, of course, our website, we have webinars, we have in-person and virtual trainings, we have YouTube channel, we have social media in Twitter and Facebook. One of the things that we've concentrated on over the past year is creating visual dashboards in a software called Tableau, which probably many of you are familiar with, and you probably, even if you don't know it, you've seen data displayed through Tableau, which is a really fantastic software platform. We've created platforms that or dashboards that can be viewed by basically by anybody just getting to the website publicly. And an example of that is the Pediatric Readiness National Pediatric Readiness Project webpage, which is displayed right there. So this is a live map of response rates of the states and the nation as a whole, as we've been through this, we're going through the National Pediatric Readiness Project assessment, which actually ends today, August 31st. So we've been able to update this map basically on an hourly basis. And so anybody can access this. And that's important because this project is a very collaborative project in nature. We've got lots of partners, the AAP, ACEP, ENA folks who've been helping us kind of push out the word. So they can go to that at any time and see what a state response rate is, and they can send that to their chapters and help them to see it as well. In addition to a public platform like that, or a public dashboard, we have password protected dashboards that our EMSC managers can go to and get more detail. They can specifically see in their state who's responded and who hasn't responded to the assessment, so they know specifically by hospital who they need to reach out to, and they can also see more detail as far as like who might have started an assessment but not completed it. So if somebody started it and gotten all the way quite close to the end but just haven't completed it and hit the submit button, a manager can reach out to those folks and say, hey, you just need to hit the submit button and then your assessment will be complete. So there's a variety of dashboards with differing kind of levels of permission of who can access it that really, I think, have helped in the process of really gathering good response for the NPRP project. That's an example.
Thank you, Mike. And there was a question in the chat box about displaying some of these. So I brought yours up, and I put the link in for the PEDS Ready newsletter from Florida that Phyllis was referring to. So I put that in the chat box, and you can access the newest version of this, as well as a number of their state-specific newsletters that they have sent out. So Emily, we'll go to you next. What have with the methods or channels that you feel have been most effective in sharing your news and successes?
Yeah, so similar to all of you, we leverage a lot of different channels. We obviously have our website, email blasts, the Pulse newsletter, social media. We do a little bit with external media. We have our impact materials, which are things like a historical timeline and an annual report. And each has its purpose, and they might reach a certain segment of our audience, but they're certainly all intertwined. What I've really loved seeing, and I think is really unique to EMSC, is the power of our collaborative partners like AAP and ENA, as well as our state partnerships. So when we provide them with materials and sort of like sample messaging or graphics, and then they share across their channels, it really just our impact and our reach just triples and increases exponentially. I do think Pulse is effective in some ways. It's seen as sort of a reliable and consistent source of news. It definitely has some room to continue to improve. We are a QI organization, so there's always room to improve, I suppose. But communications are also only as good as the technology they run on. And so, for example, with Pulse, we're navigating some technical challenges with our deliverability. So that's always something that comes up now and again, is sort of dealing with the IT and software side of things. But yeah.
Thank you, Emily. And I'll put up a screenshot of the Pulse just so people can see that. And I'll put a link, but this is the hot off the press today's issue of the Pulse that has some articles and is also a clickable newsletter. So it would take you to a deeper dive for some of these stories. And thank you for sharing that. So I appreciate the request, and thank you, Tamara. We could share some additional links if others are interested in learning more. Moving on to the next question. So we talked about successes, and let's talk about challenges. So what do you think has been the most challenging or will be the most challenging aspect of communicating about your investment per program? And Eileen, we'll start with you again.
Great, thank you so much. And I think Mike really alluded to this when he was talking, and that is there are really a couple of parallel issues that contribute to the really complex nature of our mission of communicating. We have a wide variety of audiences with really disparate needs, each with their own complicated environment, which is one issue. And then we're trying to communicate important particulars to people who are completely saturated with information. And then to add to that, we're competing against all these other entities that are delivering similar information in a world that is completely saturated and really more self-curated than ever before. So I think our biggest question is, how do we get the right information to the right people in the right way and cut through everything else that is vying for people's attention, and make sure that they know that the information that we're delivering is legitimate. And so I just want to move from that to one successful way that PCARN has been able to do that, kind of cut through that issue. And that's the weekly at PCARN team posts. They post questions to the audience. I think that's a super strong approach because, for example, last week the question was, what is your second line treatment after benzodiazepines for ongoing seizures? So then this garners interest and follow up to see what the answer is to this question. And it also allows us to see where potential knowledge gaps exist. If the answers of the audience don't align with current research, then we really have an opportunity and have identified a need. And thank you for putting that up there, Marc. That's exactly right.
Yeah. And Eileen, I think this concept of getting those small bits of information through the massive abundance of information out there. And another example here, just to look at the latest tweet from the PCARN team, is trying to not ask people to go read a whole article, but to look at the distillation of that article down into what we hope is usable information for frontline providers and patients and families. And if they want to look at the whole article, having a link and access to that. So one of the terms that we've used in this is not just disseminators, but actually synthesizers of data. So distilling that data down into bite-sized chunks. Thank you, Eileen. So Phyllis, can you share from your perspective, what do you think is, has been, will be the most challenging aspects of communication?
Thank you. Well, some of the same things that Eileen mentioned, everyone's just completely bombarded, overwhelmed. But I always like to remind everyone that 80 to 85% of children in the United States are sent in general emergency departments. And this is even more common with the rapid rise of freestanding EDs. And then EMS agencies are really not, pediatric EMS agencies, other than a few interfacility and neonatal transport teams. So the problem is we're competing with all these other really exciting adult topics, like STEMI, stroke. There's just some, incredible technology and new advances going on in adults, and they're seeing more adults. And then, COVID is just, put a much greater divide. So the adult acuity and the numbers you're seeing far outweigh pediatric issues. So if you get their attention, you've got to be very succinct. If you come to them, some of the things that are important to us in pediatrics are just not that important to them. So you have to think about, is this really important for me to take their time with today? And just remember that pediatrics is just one issue. And I think if you don't work, if you only work in pediatric land and you're not in more of a generalist land, it's sometimes kind of hard to understand what they're going through. And that kind of brings us back to one of the basic tenets of this program, is we're trying to integrate into the existing system, not create a separate system. So one example I'll use is Florida started these incredible resuscitation academies. And it was kind of off the Seattle model, but they mimicked, they changed a little bit. And they just, when they have time and they have funding, they hit the road and go to these rural areas. And it's just dramatically changed outcomes for adult cardiac arrest. So I'm like, well, wait a minute, I want the kids to be involved. And so, we did help sponsor some of those resuscitation academies, and they have now added a pediatric component. It's the same basic principles. If some of the things you do for cardiac arrest in adults, it's the same thing for children. So, we really have to find ways, same thing with disaster committee, we have to integrate that. So I think it's just the biggest challenge is, we're competing with all these other great topics that are not all pediatric related.
Thank you, Phyllis. I really appreciate that comment and the sense of integration, because one of the things that we've recognized as an EMSC program is that oftentimes, we need to be careful about just talking to each other, and we need to get in the ear holes and into the visual space and mindset of many of those other individuals out there. So I think that's a great point, Phyllis, and the resuscitation course is a great example of that. Mike, how about you from a NEDARC perspective? What are your thoughts in terms of most challenging aspects of communicating about your investment?
Well, again, as we stated, it's given that people have so much information that come to them. It's one of the biggest challenges I think is taking the information that we have, because we gather a lot of information, and there's a tendency to want to kind of share all of it and explain all of it and give give all the context and everything so that everybody has a good understanding, which ends up being a lot of information. And so then people just don't have the bandwidth to review all of that. So I think one of the big challenges, again, is taking distilling down what the nuggets are in the message, and then conveying that in a simple, succinct, hopefully a visual pleasing way, because that tends to help people to stay focused on really the message that you're trying to display or trying to share. So, I mean, again, that's a challenge. And it takes a lot of work. It takes a lot of work to create a simple, concise message. It takes a lot more work than it would appear when you see the message. The other thing I would say is the other challenge, I think, is I was at a site visit. This was many, many years ago. We were meeting with an advisory board committee in this particular state we were in, and we were talking about the need for data and what data they had available to review how effectively their systems were operating. And one of the people in the advisory committee finally said, she was kind of exasperated, said, we've become very comfortable making decisions that are not based on data. And that is concerning to me. And I that quote stuck with me over all these years, because I think she was voicing something that was common, probably more common than we'd like to think, is that people are sometimes comfortable making decisions that aren't based on good reliable data. So I think that sometimes can continue to be a challenge, as well as is helping our broader audiences understand the need for data and its value in terms of how it can provide direction for us, rather than trying to make decisions based on just anecdote or intuition or other types of things. So I think that can be a challenge too.
Thank you, Mike. And just to share, here's an example, I think, of partnering with others so that the message is not only coming from us. I think that EIC, EMSC, NEDARC, and others worked with our partner organizations for PEDS Ready, but I thought that PEDS Ready really did a great job after you complete the survey, is that you get a gap analysis and get some resources, Mike, with some data, so that we're actually helping them instead of just asking them to do something for us. And I think that strategy worked really well.
Yes, and if I can just say a bit more about that, I mentioned that we have products that for the public and for our managers, but we also, in that just what you pointed out, Marc, in that same vein, because people invest their time into filling out an assessment and sending it back to us, so that we have this information. We want to really get back that information to our respondents. So we do. Hospitals receive this immediate gap report when they complete the NPRP assessment, with their score and with some comparison scores, and then a kind of a breakdown of the entire scoring process and where they can see areas for improvement. It's a very nice, really wonderful, visual sort of a gap report that hospitals can print and save, and then use that for their QI efforts. And then with our performance measure survey, the EMS agencies, we've this goes down to 15,000 agencies. We have created basically an aggregate report that summarizes the data across the country from that from that information. And we are right now actually just sending that out to 15,000 EMS agencies across the country. So even those that didn't respond to the assessment, so that they can see it, they can have an idea of these areas and the importance of it, and how, what we're seeing on a national basis. And it, helps us to helps to create a more of a sense of engagement.
Thank you, Mike. And I'll just share a snapshot of that as well, just to give people an idea of how you've synthesized that data. And this will go out to EMS leaders across the country. Here's, the example that would be sent to Kentucky and give that information, and can be used by state partnership program managers as well as other advocates for this work. Thank you so much. So Emily, how about you to round this out here? What do you think the most challenging aspects of communicating about your investment are?
Yeah, so I definitely echo what Phyllis and Eileen were saying, especially about the having so many audiences with unique and very discrete needs. And often we're trying to make one channel sort of serve all of those audiences, which can be tough. We also just have so much going on, both at EIIC and EMSC. And I just, especially as a newer person, I think if, we have trouble keeping track of everything that's going on, you have to imagine the average clinician in ED is also, overwhelmed with all the information we're providing to them. So I think figuring out ways to sort of prioritize what we share and better synthesize our work across investments would be really helpful. I also think EIC has its own sort of unique challenge in that we have a sort of dual communications lift. On the one hand, we're sharing information about our own specific QI work, but we also are supposed to help support efforts across EMSC. And our website is a good example of this challenge, where it can be really hard to know what information is related to EIIC specifically and what information is about EMSC more broadly. That's something that we're working on continually, but it's definitely a sort of difficult dynamic. Oh, you're on mute, Marc.
Thank you. Yeah, thank you so much, Emily. So, with that, I think just to summarize a few of the constructs that we've discussed here, that we have a shared mission with many audiences. We have our external audiences, which we've mentioned. We have our internal audiences and communicating with each other. And I think it's important through the All-Grantee meeting and other venues that we do our best to keep track of what each other are doing and share each other's successes and challenges, and advisory boards and steering committees, and then others within EMSC, such as HRSA and our collaborative partners. Just in speaking to the images that I brought up earlier, here an example of the diversity of challenges. So PCARN, the different newsletters, the Twitter accounts, the letters that go out to people, the NEDARC surveys, the Pearl coming from Florida. These are all fantastic and synergistic. And I think that what's been really exciting is starting to see actually resharing of each other's posts. So seeing things that are coming up in the Pearl, as well as the EMSC Pulse National newsletter, that are coming from NEDARC in the form of a infographic. And I think that is a wonderful synergy and success. So with that, I wanted to move to what I expect will be the final question, and then we can open up for more audience questions here, which is, what opportunities do you see, if you could have a pipe dream for collaboration across EMSC communications, and/or where you'd like to be in 5 years, to say, man, we kicked ass on communication, we're doing a great job. Eileen, I guess we'll start with you. What would you see as sort of a marker of success? Is it meeting someone on a plane that says, wow, you work for EMSC, you did PCARN, that's amazing?
I wish. That's a great question. And if I had the answer to that question, I'd probably be like winning the lottery. I think that, we increase our collaboration by having all-grantee meetings like this one. And we leverage our work on social media, and the EIIC tries to bring everything together. But I think the key for us is to coordinate our efforts better, to ensure that we're not doubling our work, which I think we are. We're redundant in the work that we're doing. And I would want to make sure that we're not contradicting each other at any point. And so pie in the sky is how do we best coordinate our efforts? I wish I could have the answer for how we do that, but I think we are doubling our efforts, and we don't want to do that. We want to be able to spread the wealth and get the information out to people without layer upon layer of efforts from everybody. So I guess that's all I can say to that.
Yeah, no, thank you. And I would say, Eileen, to echo that, not necessarily doubling, but actually potentiating our efforts. So I would say that, if we say 2 times 2 can equal 8 instead of the 4 of us, my kids would call that monkey math. I would call that potentiating and sort of, enhancing our successes. So Phyllis, how about from your perspective? Because I think that the frontline providers do often see, and this is something that is, I know is a challenge in my state partnership experience in Connecticut, the national folks can sometimes be intimidating and it can be, seem distant. So, what opportunities do you see for us to hit those state partnership programs and their constituents so that they feel as though we're meeting their needs?
Well, one of the things I think we've, somewhat overcome is just getting a contact name. There's so much turnover in emergency department, nurse managers, and EMS. And so when we just said we were asking for PECs, we weren't getting a whole lot. So we call everyone a PEC. You're a pediatric emergency care champion. You're a friend of EMSC. Call whatever you want to call yourself. But do you want to get our information? And so now we have, I don't know, we're up to probably 400 or 500 people on this, Excel spreadsheet. And we send them, when we have a committee meeting, they're invited to our committee meetings, our state EMS for Children Advisory Committee meetings. If we send out, a late breaking alert about an educational opportunity, they receive the Pearl, etc. So I love it when I get an email that says, hey, I heard about this. Can you add me to your list? That really makes my day. We have one email, pedready@jax.ufl.edu, and that goes to me, my wonderful admin assistant, Amy. It goes to our program manager and director at the state level. I think when I've been involved with this program for so long, in the old days, it was AAP, ACEP, ENA, and now we've really broadened it. I love trauma. I've worked in a level 1 trauma center my whole career that's not a children's hospital. So I'm really excited about the collaboration with American College of Surgeons and program managers. And, we're bringing in all of these other partners, but it also makes it hard to keep up with what everyone's doing. So just one example is we discovered, there's this great group of people called trauma program managers. So we appointed a liaison to them, on our committee and asked, would you all like to be listed as a PEC, or as a champion? And so we, that added another, 20 or 30 names to our list. So I think we just have to keep, I think of it kind of like a puzzle, and we have to fit our little piece into their puzzle. We can't create our own little puzzle. Another great area for opportunity, and this is just, all states have great examples of what they've done, is our Department of Health created a rural liaison that works with EMS agencies and EDs. And she just transformed my life and really bringing to me what is really going on in the rural area that, that I forget about. And then just the more we can find others that can take out our message, the better. So I think there's just opportunities abound, but I love to see my list grow.
Excellent. So Phyllis's pipe dream is to have more people want to hear from her. I like that. Not to say remove me from the list. Eileen says that we're potentiating each other and not duplicating each other's work. Mike, how about you at NEDARC? What do you see as opportunities or where would you like to see us in 5 years?
Well, there really are a lot of, there are a lot of exciting opportunities that are out there. And, some I think that we've already started to explore and use, and hopefully can increase those, and others maybe we can tap into. One of the things that NEDARC is located in the same building as the PCARN Data Coordinating Center and the NEMSIS Technical Assistance Center. So we have great great collaborations right between us here. Even that, we all get so busy in our own day-to-day stuff that it's easy to kind of, to not reach out all the time and to not take advantage of some of those. So I think as we've gone down this path of collecting data from EMS agencies and hospitals sort of on an ongoing basis with performance measures and with the National Pediatric Readiness Project and with what's going to be coming up with the pre-hospital pediatric readiness project, we've created this database of basically of hospital and EMS agency contact information across the country, with names and addresses, and they all have what we call a portal ID, so we can track them sort of on our side, so we can compare data across time with the same agency or hospital. And so I think there's opportunities for, there could be opportunities for helping to use some of that data in other research efforts that are going on, with partner organizations and helping to further the EMSC mission. I think we've worked a lot in the NPRP project with the AAP, ACEP, BNA, and ACS, and I think those are relationships that will continue to grow and to flourish, and they've been so helpful and instrumental to us in really promoting the pediatric readiness assessment. So I think those relationships we can continue to to keep strong and to help with our future efforts. One thing you probably many of you heard Dr. Newgard speak a little earlier today. We've used that pediatric readiness data from when we initially collected it in 2013. We set up basically a research sort of a process, an intake process by which researchers could request the data and use it for their research purposes. And we've had a lot of folks that have done that, and Craig's a good example of using that data and linking it with other data sets to really get to this issue of what kind of difference does readiness make in terms of patient outcomes, and that information is very promising. So I think as we get this 2021 data in with the NPRP assessment, again, that closes at the end of the day today, and we're getting more and more assessments in, which is great. We'll clean the data and get it ready for analysis and sending out to state managers and so forth. But there'll be opportunities for, again, further research based on this this new round of data, which I think will be really useful for us.
Thank you, Mike. And I think it makes it for a very compelling communication to state that by improving pediatric readiness, you will save X lives, which came up in Craig's talk today. I think that's a very different frame than, because the kids, or do it for the kids. So I think it's a very compelling argument to say, by doing this, it will cost this much and save X number of lives for those of us that are communicating the information out. We look forward to seeing Craig's results. Emily, I'm going to bring that question to you, but actually dovetail another question from Jane. And if any other questions come up in the chat, please let us know, which is this concept approach to communication. We know that we have a variety of stakeholders, and Emily, hearing about your communications expertise, I had mentioned to you when you first came on to our team that it seemed to me like some people, when they were emailing me, kind of knew who I was, and I don't know how they figured that out. I don't know if they have some tracker on Google or something, but the emails I was getting from them seemed to really just be curated to my interest. And I think that Jane is getting at this with peer-to-peer approaches to communication, listservs, working groups, sort of collating the names that Mike and others have mentioned into groups that might not be interested in everything and feel like the content is more specific to them. So, I know that that's a big challenge, but maybe you can comment on that as an opportunity and any other opportunities that come to your mind.
Sure. So something that I'm working on, but it definitely takes a lot of sort of unglamorous database work, which I know Mike would probably appreciate. But to sort of build those targeted lists and targeted messages takes a lot of sort of infrastructure on the back end. But I am hoping that's something we might be able to work to over time, certainly. But But as far as sort of our overall, like I love all the things you've been saying and the wish list, and I've been taking notes about your comments. And I have a pretty long wish list myself. And some of them are, again, pretty unglamorous things and really sort of about our infrastructure. For example, I think something as simple as a list that we continually update about all of our channels, like what they are, how to subscribe for the newsletter, or how to follow us on Twitter, and who's responsible for them. If we want to share something through them, would be great. I was even thinking about, for the state partnerships, that would be really lovely to be able to go look and see who has a newsletter and sign up for some of them, or maybe sign up for the one that's in your state. So it's sort of a boring idea, but like an active spreadsheet of information about all the different channels we have available to us. Because even after 5 months, I feel like I'm still learning about a new channel every couple of weeks. Another thing that I would love for us to do at some point is to have something like a communications advisory council, maybe where folks from the different investments who are working on our communications come together to sort of compare notes, talk about what's going on, and to Eileen's point, make sure we're not like duplicating efforts, or that we're using the right channel for the right information for the right audience, to get back to Jane's question. So I think that would be something that would be great to work toward over time. And then pie in the sky idea, it would be wonderful if eventually we did have somewhere to better integrate all of our great contacts, like Phyllis was talking about, because we all have sort of our separate lists, but in theory, we could each have the same person on all of our lists, and then that poor person is getting hit by us, however many times a month. That definitely would be a huge lift and ask, and is many years away. But that would definitely be great. And then finally, it's something we're working toward and still sort of figuring out the details of, but I am really looking forward to us someday having some more unified branding across EMSC. So I think that that's going to be really important for our audiences who are engaging with sort of understanding that we're all pieces in the same puzzle, and understanding that we share the same mission, and how our each investment's work supports and relates to one another's. So I hope I answered Jane's question in there.
Thank you, Emily. Yeah, I think you did. And Jane mentioned, thank you for your response. So we have about 3 minutes left. Any questions? People just opening up the floor. If anyone wants to ask a question or go ahead and put it in the chat box, please go ahead and do so. Just putting up our objectives. So if people hoping that we achieve these learning objectives, which were to be able to state the value and purpose of the different programs, describe effective communication channels or strategies. We heard about a diversity of them, and commit to improving collaboration. So many hours of work go into each of these channels, and I look forward to synergy, seeing the successes that we've talked about now in 5 years. And I just want to give a heartfelt thanks to Eileen, to Michael, to Phyllis, to Emily for taking the time to put their thoughts together. And I appreciate all that everyone on this EMSC journey has done to enhance our communications, both with each other, with our stakeholders, and our shared journey to ensure optimal care. So thank you so much. We'll give you back maybe about 90 seconds, which I know I always appreciate. Go get a cup of coffee, and thank you so much. Appreciate your time.
Thank you, Dr. Auerbach, for leading this discussion. There is a group activity in the social networking room if y'all want to head on that way. Appreciate this discussion.
Thanks, everyone.
Thank you.
Thank you. Bye.